Disclaimer first. This is educational. It's not medical advice. Psilocybin mushrooms are illegal in many places and can carry risks. Clinical research is always done with careful screening, professional supervision, and structured therapy. If you're interested in treatment, speak to a licensed clinician and follow your local laws. Why are scientists, therapists, and even policymakers suddenly paying so much attention to psilocybin mushrooms? For decades they were written off as dangerous or frivolous, but in the past 20 years, a wave of rigorous studies has been uncovering something surprising. In structured clinical settings, psilocybin, the active compound in certain mushrooms, appears to provide profound psychological benefits. It's not a magic bullet, not risk-free, and certainly not a one-size-fits-all cure. But across dozens of carefully controlled trials, psilocybin-assisted therapy has shown promise for depression, anxiety, trauma, addictions, and even existential distress near the end of life. To understand why, let's start with what psilocybin actually is. Psilocybin is a prodrug. Once ingested, your body metabolizes it into psilocin, which primarily activates serotonin 5-HT2A receptors in the brain. That activity alters brain network dynamics, loosening rigid thought patterns, increasing communication across regions, and producing the vivid perceptual and emotional shifts often called a psychedelic experience. Researchers like Robin Carhart-Harris have proposed the rebus model, relaxed beliefs under psychedelics. To explain it, psilocybin temporarily relaxes the grip of entrenched top-down beliefs, like "I am worthless" or "nothing will change," letting new insights and emotional material surface. Brain imaging studies back this up. Functional MRI shows that psilocybin dampens activity in the default mode network, DMN, a set of brain regions involved in self-narrative and rumination, while increasing global connectivity. In simple terms, the usual ego network quiets, while other networks talk more freely. Participants often describe this as a dissolution of rigid self-boundaries, which can be frightening, but also profoundly freeing. Animal work adds another layer. A single psilocybin dose increased dendritic spine density in mouse frontal cortex, with changes persisting for weeks. That suggests psilocybin may trigger neuroplasticity, the brain's ability to form new connections, which could make therapeutic insights stick. But what does this mean for actual people facing mental health struggles, depression? Some of the strongest evidence is for depression. In 2021, a randomized clinical trial found that psilocybin-assisted therapy produced large and rapid reductions in major depressive disorder, MDD symptoms. Participants received 2 guided psilocybin sessions with psychotherapy, and improvements were sustained for weeks afterward. Treatment-resistant depression, TRD, is notoriously hard to manage. A 2022 Phase 2b multi-site study published in the New England Journal of Medicine gave a single 25 mg psilocybin dose with support to patients with TRD. At 3 weeks, depression scores dropped significantly compared to the 1 mg control group. Some adverse events, including suicidal ideation, did occur, showing both the promise and the risks. Another 2023 randomized trial in JAMA confirmed that even one guided psilocybin session could provide meaningful and sustained reductions in depressive symptoms. End of life. Distress facing a terminal illness often brings crushing anxiety and depression. In 2016, 2 landmark trials at Johns Hopkins and NYU gave psilocybin-assisted therapy to patients with life-threatening cancer. Both found dramatic reductions in depression and anxiety, often lasting 6 months or more. Participants frequently rated the experience as among the most meaningful of their lives, reporting reduced fear of death and increased sense of peace. Addictions are another area where psilocybin shows promise. For alcohol use disorder, AUD, a 2022 randomized trial found psilocybin plus therapy cut heavy drinking days nearly in half compared to an active placebo plus therapy. For tobacco dependence, a small open-label Johns Hopkins study combined psilocybin with cognitive behavioral therapy. At 12 months, 67% were verified abstinent. At 30 months, about 60% still hadn't relapsed, remarkable compared to typical quit rates, OCD and headaches. Early work in obsessive-compulsive disorder, OCD, showed acute symptom reductions after psilocybin, though the sample was very small. More research is needed. There's also exploratory work in cluster headaches. Some studies suggest psilocybin may reduce attack frequency, but this is preliminary. Personality and meaning. Even in healthy volunteers, psilocybin can trigger long-lasting psychological change. Studies show it can increase the personality trait of openness, sometimes for more than a year. Participants often describe psilocybin sessions as among the most meaningful experiences of their lives, sometimes comparable to the birth of a child. The intensity of mystical-type experiences correlates strongly with lasting benefits. Microdosing, tiny subperceptual amounts, gets lots of hype, but placebo-controlled studies show mixed or null effects. A large citizen science, self-blinding study found improvements, but so did placebo groups, suggesting expectation plays a big role. Safety and risks. What about risks? In clinical settings, common acute side effects are nausea, headache, anxiety, or brief blood pressure spikes. These usually resolve within a day. Serious events are rarer but do occur. In the 2022 TRD trial, a few participants had suicidal thoughts or behavior. That's why strict screening and follow-up are essential. Most trials exclude people with psychotic disorders, strong family histories of psychosis, or bipolar I disorder, because psychedelics may trigger mania or psychosis in predisposed individuals. Therapy matters. One consistent finding: psilocybin works best when paired with professional psychotherapy. Trials always include hours of preparation, 2 trained guides during the session, and multiple integration meetings afterward. The drug may open a window of flexibility, but it's the therapy and integration that help people make lasting change. Regulation: psilocybin is still illegal federally in the US, but the FDA has given breakthrough therapy status for depression. Oregon and Colorado are piloting supervised service programs. Australia recently rescheduled psilocybin, so authorized psychiatrists can prescribe it for TRD. Canada has a special access program for certain cases. Regulations are evolving, but clinical access remains limited and tightly controlled. Putting it together. So what psychological benefits are best supported so far? Rapid relief for depression, even in treatment-resistant cases. Reduced anxiety and depression at end of life. Promising results for alcohol and tobacco addictions. Potential personality growth, openness, meaning, life satisfaction. Early signals for OCD and headache disorders. But the caveats matter. Results are from controlled environments with professional support. Outcomes vary widely, and the therapy context may be as important as the drug itself. The big picture: psilocybin appears to help by 3 main mechanisms. State shift, a profound alteration in consciousness, quieting the ego and allowing new insights. Neuroplastic window, a period of flexibility in which old habits can be disrupted and new patterns formed. Integration therapy helps turn that raw experience into real-life change. When all three line up, safe set, supportive setting, and good integration, studies show real psychological benefits. When they don't, the risks can outweigh the rewards. Final word: psilocybin isn't a miracle drug, but it's a remarkable tool for opening psychological flexibility and deep emotional processing. With more research, tighter regulations, and careful use in therapy, it may become a valuable addition to mental health treatment. But for now, the most important takeaway is balance. Respect the risks, appreciate the promise, and let science, not hype, guide the way.